Canada has officially surpassed 400,000 cases of COVID-19. Quebec and Ontario lead the country with the highest infection numbers. Quebec is quickly approaching 150,000 cases, while Ontario sits above 127,000. Alberta has been seeing a surge in cases the last few weeks. They're now just above 63,000 cases, while BC is over 35,000. 12,470 people have died of COVID-19. More than 318,000 people have recovered. The vaccine might be the flickering light at the end of the COVID-19 tunnel, but it's all in the details. Ontario has announced the experts making up the COVID-19 distribution task force led by retired General Rick Hillier. This includes experts in science, equity, and healthcare fields. The group met for the first time earlier today. And what's the game plan? Vaccine Task Force member Dr. Isaac Bogoch and CTV News Infectious Disease Specialist Dr. Abdu Sharkawy join us now. Hello, doctors. I hope you are well. Happy Friday. I'm going to start. It's so nice to see you. I'm going to start with you, Dr. Bogoch, because you're a member of this newly created Ontario Vaccine Task Force, and your first meeting happened today. Can I ask you what was discussed?
No. I've been on the task force for 5 minutes. In all fairness, the big picture is, we're going to get some vaccines in Ontario at some point. Again, I don't know when. And the whole plan is, how do we efficiently distribute these throughout the province in an equitable manner? How can we do this in the smartest way possible? And I think, obviously this is the time to really hammer down some of the details, because I think we're going to be seeing these vaccines sooner rather than later, and we've got to get the plan in place right now.
So do you think, in your opinion, is it a little late? Should you have not started this earlier? Look, I don't know. I'm not an expert, but it seems to me that the man in charge of the federal vaccine distribution, Major General Danny Fortin, says provinces should have their distribution centers ready by December 14th. So do you think that it will take just 2 weeks to get, less than 2 weeks to get that done?
Well, I think that when you look at the members of the task force, and then you look at there's going to be various subgroups, I think we're going to see a lot of action in a very, very short period of time. So, I mean, obviously the goal is when vaccines land on our doorstep, there should be no waiting time. Like those vaccines should be deployed right away. And, obviously there's not a ton of time. But on the other hand, when you look at the leadership of this group, we're led by an individual who's got a track record of getting things done. So, I have confidence. I have total confidence that we'll be able to do this. On the other hand, of course, let's not be naive here. There's going to be some bumps on the road. Of course there are, and of course we got to learn along the way. But at the end of the day, I think we'll be able to really do this effectively.
Dr. Abdu Sharkawy, I mean, this is unprecedented in Canada, this kind of vaccination campaign. I know people get vaccinated every winter for the flu, so there is somewhat of a campaign, but this is unprecedented. So, we all wondered about the list of priorities, groups who should go first, second, first. Is it age, like Dr. Theresa Tam believes, once, the frontline workers, and long-term care, people in long-term care homes? Is it the risk factor? Is it jobs? How do you see it? I mean, you guys are the doctors, you're the scientists. How do you see it, Dr. Sharkawy? How should this list of priorities be drawn?
Yeah, that's an excellent question. And the simple answer, it should be based on those who are most likely to do poorly if they are infected with this virus, and those that are most likely to spread the virus depending on the setting in which they work. And so that really designates residents of long-term care facilities first and foremost, along with frontline workers. And then beyond that, I think you look at age, and you look at people whose immune status would put them at a higher risk of a severe outcome from COVID-19. And then span out to public-facing jobs and people who work in the retail sector, transit workers, etc. I think it's going to be a fairly well-designed scheme. I agree with Dr. Bogoch. I think the devil is going to be in the details, that we want to make sure that deployment happens efficiently. And if we can do that, I think we'll do a good job of making sure that the most importantly targeted groups are vaccinated first.
I want to check in with you, Dr. Sharkawy. You know, in your hospital, for instance, as the number of cases grows, is your hospital at capacity? Because I follow you on social media, and your posts are a reality check, giving us accounts of those COVID patients that you treat. So I'm wondering, aside from those COVID patients, are people who are waiting for surgery being turned away?
Well, thankfully, at this point in time, in my institution, we're not at or over capacity. But the problem is that situation is very fluid, and it can certainly change. And it can even change based on what happens in other parts of the city or in other health districts. I think it's no secret now that the Osler health system in Brampton is in a crisis mode. And we have patients that are transferred from their facility on an ongoing basis. That should be a warning sign that situations can change fairly quickly, and one region can become very distressed very quickly. There are other parts of the province where the ICU capacity has been over 120% for a while now. So the situation can change. And in terms of elective surgeries or other non-COVID related issues, there's two issues there. One is that as capacity starts to decline, things necessarily do have to be limited in terms of care that's provided. And the other problem is that there's a sense of fear amongst the public at large that hospitals are becoming a repository of COVID-19. And so patients will avoid coming to the hospital, and they won't seek care in a timely fashion. And that's a tragedy we really desperately need to avoid. We saw firsthand that it happened in the first wave, and a lot of people ended up either dying or presenting to hospital a lot later than they should have to have their healthcare needs met.
And Dr. Bogoch, you know, do you anticipate Canadians running to get vaccinated? Because what I hear is there's some sense that there's a bit of reservations here, some fear they'd rather wait to see, you never know, the long-term effects of these vaccines. They've been rushed through. You are two men of science. Do you trust these vaccines? I'll start with you, Dr. Bogoch. Is there any reason to fear them?
You know, in all fairness, I don't think so. And I really think that when we actually scratch the surface and look at how these were produced and how they were validated in the clinical trials, like, this is a sound process. They didn't cut any corners. The production was very reasonable. They did the requisite phase 1, phase 2, phase 3 clinical trials. Now independent bodies like Health Canada and the FDA, for example, in the United States, are evaluating the data. You know, this is the process. That's how we get new drugs and new vaccines onto the market. So the process is sound. There's no corners that were cut. So I'm very satisfied with this. Now, of course, I think it would be very helpful for these phase 3 clinical trials to be published in the peer-reviewed medical literature, so the medical and scientific and public health communities can pore over the data. You know, that's excellent for transparency. But like the process is sound. And to your other point, I think it's very important that you mentioned that, you know, there certainly are going to be some people who just won't get a vaccine. And, you know, that's an issue that we've had long before COVID-19, and we'll be dealing with that long after COVID-19. And of course, we need to reach out and listen to these communities. But there's also a group of people, as you point out, that are perhaps a little hesitant. And, you know, maybe they would be amenable to vaccination. But, you know, obviously we need to have these conversations. We need to listen to the concerns. We need to listen to the fears. They might want some more information. And really, we need a good communication strategy and an excellent community engagement strategy just to alleviate people's concerns. And I think if we do that well, we'll be able to really get some good uptake of these vaccine programs that are going to roll out shortly.
And when is the next meeting of your task force? I mean, are you guys going to meet regularly every day? How does this work?
Yeah, I'm not entirely, to be honest, I'm not entirely sure, but I imagine
it's too new.
Yeah, I mean, like, it literally, this is day 1 and it's 5 minutes old. So I basically am trying to clear much of my schedule so I can dedicate, you know, almost all my time to this over the next few weeks and, of course, in the months ahead. But I think there's going to be a lot of heavy lifting done over the next few weeks because we don't know when vaccines are going to land in Ontario and in Canada, but we have to be ready for when they do, because obviously the second they land, we want to get those needles rolled out into arms. And as Dr. Sharkawy mentioned, we already know that NACI, the National Advisory Committee on Immunizations, already mentioned what the priority groups are. I think if you look at all the different provinces, they're going to be somewhere very similar to what NACI is. So we've got a lot of work to do in the next couple of weeks to be prepared for whenever vaccines arrive.
I know I just have a few seconds left, but Dr. Sharkawy, I know we had this conversation yesterday. Once this vaccine starts getting doled out, it's not the end of the road. We're not out of the woods, are we?
Not by a mile. And the important thing to remember is that a lot of these vaccines are dual dose. They're going to be given 21 days apart. You're not immune during that time frame. It still takes time for the immune system to constitute itself even after the second dose. There's going to be gaps between those that are vaccinated and those that aren't. We've got to keep up with our public health measures, hand washing, distancing, masking, limiting our contacts. If we do that faithfully and consistently, we have an excellent chance of the vaccine spelling the end of this pandemic at some point in the not too distant future.
Dr. Sharkawy and Dr. Bogoch, we're all a little bit smarter after we listened to you. Thanks so much. Have yourself a great weekend, gentlemen.
Take care.